Hi, it's Director Hassan, host of the Modern Parenthood podcast. And May is Mental Health Awareness Month. And today I have Dr. Kanthi Raju with me here to talk about all things mental health. But before we get to talking about mental health and stress and its effect on infertility, I'm going to start off with 3 examples of the typical patients that I see coming to my office.
This podcast is meant to provide information on reproductive health. It does not establish a physician patient relationship, and we would urge you to contact your treating provider regarding your care.
You've all heard these stories before. Let's have a patient. Let's call her Samantha. She is a 36-year-old female. She and John have been married for about 8 years and actively trying to get pregnant for the last 4 years. Throughout their treatments, they've already had now 2 miscarriages. And in vitro fertilization with preimplantation genetic testing and euploidy screening is recommended as the next step. So IVF, meaning making the embryos outside the body, and preimplantation genetic testing and euploidy screening, testing the embryos for abnormalities like Down syndrome, Turner syndrome, trisomy 16, trisomy 18, monosomy X, genetic causes that can lead to miscarriages or failed implantation. Samantha and John are overwhelmed. They've been through several miscarriages. It's been many years of trying to get pregnant, and they don't know how to mentally make the next step. Let's talk about another patient, Jonathan and Jennifer. They've been trying for years to get pregnant, and they finally gave up and said, we're just going to adopt, and they adopted. They're happy. They're parents now by adoption, and a few months later, they get pregnant spontaneously. A third patient, Michelle and Matthew, they tried for many years to get pregnant and finally conceived on their first cycle of in vitro fertilization. After their daughter is born, they decided, oh, we don't need contraception. It's been hard for us to get pregnant. But Michelle gets pregnant 6 months after their daughter is born. We hear these stories over and over again. Once the stress is eliminated, somehow people have been able to get pregnant. We hear stories of doing fertility treatments and it becomes overwhelming. And how do you mentally make the next step happen for you? Well, Dr. Kanthi Raju is here with me today, and we're going to be talking all things mental health.
There were some comparative studies that looked at women undergoing fertility treatment and that level of stress and their symptoms, and they found them to actually be comparable to women who were undergoing cancer treatment or cardiac rehabilitation or even hypertension. So, oftentimes we think about, well, it's very simple to focus on mental health and addressing symptoms for women who are going through severe medical issues like that. But I think it's important to recognize that because those symptoms can be very similar and they can occur in women undergoing fertility treatment, those very similar or same interventions are very important in women undergoing this and couples undergoing this.
Yes, can you tell us a little bit about the relationship issues that the stress brings along, as well as how the stress affects the male versus the female partner in different ways? I will tell you, as someone who's been practicing for a couple of decades now, I've seen marriages end after fertility treatments fail. So tell us a little bit about how men and women handle the stresses differently.
Well, oftentimes we talk about women undergoing stress during this time, but it's both. It's women and men. It's couples. Men can have that kind of oxidative stress that can decrease sperm health, and there's also that stress that can affect their libido, their sexual functioning, how they see themselves in terms of their self-esteem, how they feel good about themselves. There's dynamics that they bring into the relationship. What was their kind of background in terms of how they saw family life. with each other even before they got together. So I think for women, there's certainly some symptoms to consider, but we see this in men as well, in terms of how they handle things. They may be a little more distant. They may pull back. They may be that you may see irritability. You may see an increase in alcohol or substance use associated with these symptoms in men.
You're absolutely correct. I notice sometimes the partners of my patients, they feel like they have to be strong for their partner who's undergoing these treatments, because they're not the ones who are doing most of the treatments. And so because they feel like they have to be strong for that partner, sometimes they don't allow themselves to be emotional about certain aspects of the treatment or even grief whether or not the pregnancy test was negative. And so it's important to understand that partner plays a real role as well, in terms of helping the partner or the patient with the pregnancy and understanding their role, but also they need emotional support. So the partner also needs emotional support as well.
That's correct. It is. I think it's important for couples to realize that it's healthy to give each other space to have those emotions, to be angry, to cry, to be emotional. It's okay to say no to a gathering or a family event. I think it's important to give yourself that space to acknowledge the emotions you're having, accept them, and work through them together, even together or even separately. I think it's really important to just give each other that safe space.
Wonderful. Thank you, Dr. Raju, for being on the podcast. Y'all know I like to end the podcast with debunking some myths. So let's start with some myths here as it relates to mental health. The first is, if I just relax, I will get pregnant. And the fact is, that's not true. Otherwise, a bottle of wine and a beach vacation would fix everything. And so there are real physiological reasons why we don't get pregnant. And that's why it's important for you to see a reproductive endocrinologist and infertility specialist.
That's true.
Another myth that I want to debunk is, if I'm stressed, I will not ovulate. Well, we live in 2026 and there are lots of stressors right now, and we're all under stress. And it's just like Dr. Raju said, the chronic stress is what takes a toll on us, but daily stresses are part of our common day-to-day function. And so many people who are under day-to-day stresses are still ovulating. So if you're not ovulating, I would not chalk that up just to stress, and I would go see a fertility physician if you're struggling with ovulation.
So, one of the most common misconceptions that you had mentioned earlier, where that if you just relax, you can get pregnant. And for many people, that's actually that's a bit dismissive of patients' emotions and feelings about it. It, in some ways, invalidates their real life experiences associated with infertility and stress, and it minimizes their own experiences. And for some patients, it can make them feel guilty or make them think of, well, am I not doing everything that I can for this process? So I think it has significant impact on patients to say, for even just the general public to say, well, if you relax, you're going to get pregnant. So I think you touched on a very important topic in terms of how to address that. I think for patients, it's important to recognize that they're doing all that they can for themselves. And it's, takes a great deal of focusing on themselves and their self-care and understanding that it's a journey and it's a process, and seeking support from their professionals and their family and their community, I think, is important.
I want to thank Dr. Raju for being our guest today and talking about mental health and the struggles that our patients go through with fertility treatments and stress and the toll it takes on their mental health. This is Mental Health Awareness Month, and we will start off our next episode talking about treatment options for mental health as it relates to fertility treatments. So you don't want to miss the next episode. Please follow, like, and subscribe Modern Parenthood Podcast.
Pioneer.